An anal fistula is a condition that can be both uncomfortable and somewhat difficult to talk about. Simply, an anal fistula is an abnormal tunnel or connection between the inside of the anal canal and the skin around the anus. Imagine it as an abnormal tunnel that connects two places it shouldn't. This abnormal tunnel or connection often develops as a result of an infection that starts in an anal gland. This infection usually causes a collection of pus or an abscess near the anus. When this happens, the body tries to drain the infection. So sometimes it creates this tunnel so the infection finds an exit route through a new opening in the skin, which is called the fistula external opening. The real problem here is that fistulas don't just go away on their own. That's because they're lined with infected tissue, and they keep producing infected fluid or pus that drains through the external opening. Think of it like a chronic wound that's constantly infected and won't heal on its own. Anal fistulas are relatively uncommon, affecting about 1 in 10,000 people, with men being more frequently affected than women. They are especially prevalent in individuals with conditions like Crohn's disease, where nearly a third of patients may experience fistulas as a complication. Types of anal fistulas. Not all anal fistulas are the same. In fact, what makes this condition tricky is that the tunnel can take different paths through your anal muscles. Some fistulas are straight and simple, like a direct line from point A to point B. Others can be complex, with multiple branches like a tree's root system, or they might curve and wind around in complicated ways. So, here are the main types. Number 1. Intersphincteric fistulas. These are the most common type. They pass through the internal sphincter muscle and come out near the anus. Think of them as taking the shortest possible route from inside to outside. Number 2. Transsphincteric fistulas. These are a bit more complicated. They go through both the internal and external sphincter muscles. Imagine them taking a longer route through more muscle tissue. Because of its pathway through both muscles, it's often more challenging to treat without compromising sphincter function. Number 3. Superficial fistula. These are the simplest and most straightforward type. They're very close to the skin surface and don't involve any sphincter muscles at all. They just travel underneath the skin from the anal canal to the outside. They're actually the easiest type to treat because they don't involve any muscle damage. Number 4. Suprasphincteric fistulas. This fistula begins above the internal sphincter and travels over it, then loops around the external sphincter before extending to the outside skin near the anus. Although it's less common, it can cause more significant issues due to its higher path. Number 5. Extrasphincteric fistulas. These are the most complex type. They start from outside the sphincter muscles, go around them completely, and end up inside the rectum. They're relatively rare but can be challenging to treat. Causes of anal fistula. Most anal fistulas start with an infection in one of your anal glands. These small glands are located inside your anal canal, and when they get infected, they can form an abscess. If this abscess doesn't heal properly or isn't treated correctly, it can develop into a fistula. Other common causes include: Number 1. Crohn's disease. This inflammatory bowel condition makes you much more likely to develop fistulas. In fact, nearly a third of people with Crohn's disease experience fistulas. Number 2. Previous anal abscess. About 50% of people who have had an anal abscess will develop a fistula. Number 3. Diverticulitis. This is a condition in which small pouches in the digestive tract, called diverticula, become inflamed or infected. The infection can spread and affect the anal area, increasing the risk of fistula formation. Number 4. Trauma or surgery. Any injury or surgical procedure in the anal area can increase your risk. Number 5. Other medical conditions. Tuberculosis, HIV, or other conditions that affect your immune system can make fistulas more likely. Symptoms of anal fistula. Anal fistulas can have a range of symptoms that vary depending on the type and severity of the condition. Many people describe a throbbing or pulsing sensation that never quite goes away, especially during activities that put pressure on the area, like sitting or having a bowel movement. One of the most noticeable signs is drainage from the external opening near your anus. This drainage might be clear, bloody, or pus-like, and it can stain your underwear or cause wetness throughout the day. The amount can vary. Sometimes it's just a little, other times it might be quite a lot. The area around the fistula often feels swollen and tender to touch. You might notice redness and warmth in the area. Some people experience itching or irritation of the surrounding skin due to the constant moisture. When infection flares up, you might develop fever, feel more intense pain, and notice the drainage becoming thicker or changing color. The area might become more swollen and painful than usual. Many people also report feeling extremely tired when dealing with a fistula, as your body is constantly fighting infection. You might find yourself feeling generally unwell or run down. Diagnosis of anal fistula. Diagnosing an anal fistula typically starts with a visit to a doctor, often a proctologist or colorectal surgeon, who specializes in conditions of the rectum and anus. During the consultation, the doctor will take a thorough medical history, asking about any past infections, surgeries, or conditions like Crohn's disease that could increase the risk of fistula formation. The next step usually involves a physical examination of the anal area. The doctor may look for visible signs of the fistula, such as an external opening near the anus where pus or other discharge may be present. They may gently press the area to see if there's any drainage from the opening, which can help confirm the presence of a fistula. Sometimes, especially if the fistula tract is complex or not immediately visible, further imaging tests are necessary. Here are the most common ones. Number 1. MRI. This is the best tool for complex fistulas. It shows detailed images of everything: the fistula's path, any branches, and its relationship to your muscles. It's especially helpful for planning surgery. Number 2. Endoanal ultrasound. This type of ultrasound involves a small probe inserted into the anal canal. It uses sound waves to create images of the anal area, helping the doctor see the fistula's path and determine its type. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for anal fistula. Treating an anal fistula typically requires surgery, as these tunnels rarely heal on their own. The specific approach depends on the fistula's type, location, and complexity. The main goals are to close the fistula, prevent recurrence, and preserve the function of the sphincter muscles to avoid incontinence. Here are the most common surgical options. Number 1. Fistulotomy. This is the most common and effective surgical treatment for anal fistulas. Here, the surgeon opens up the entire fistula tract, scrapes out the unhealthy tissue, and lets it heal from the inside out. This surgery is most suitable for simple, low fistulas that don't involve much sphincter muscle. Number 2. Seton placement. A seton is a special thread that's placed through the fistula tract. It helps keep the fistula open and allows it to drain. This helps reduce the risk of abscess formation and can also be used in preparation for additional surgical procedures. This method is often used for more complex fistulas or when preserving sphincter muscle function is crucial. Number 3. Lift procedure. Lift is an acronym for ligation of intersphincteric fistula tract. This newer technique involves accessing the fistula without affecting the sphincter muscles. Here, the surgeon ties off the tract and removes the infected tissue. This technique is particularly useful for transsphincteric fistulas. Number 4. Advancement flap. In this procedure, a piece of healthy tissue is used to cover the internal opening of the fistula. This allows the fistula to heal without requiring significant muscle division. It's often used when the fistula is complex or when other treatments haven't worked. Non-surgical options. While surgery is the primary treatment for most fistulas, there are non-surgical options that may be effective for people who are not good candidates for surgery or for whom the fistula is not causing significant symptoms. Number 1. Antibiotics. If there's an active infection or abscess associated with the fistula, antibiotics may be prescribed to control the infection. However, antibiotics alone won't cure the fistula, as they can only manage the infection. Number 2. Fibrin glue. This is a newer treatment where the fistula tract is filled with special materials to help it heal. While less invasive, they tend to have lower success rates than other surgical options. Number 3. Collagen plug. This is a small plug made from collagen that's inserted into the fistula tract to encourage healing. Like fibrin glue, it has a lower success rate and is generally used for simple fistulas. Recovery and aftercare. After surgery, proper care is crucial for successful healing. Here's what you need to know. Number 1. Keep the area clean. Keeping the anal area clean and dry is crucial to prevent infection. Using warm water to gently cleanse the area after each bowel movement can help, as well as using soft, unscented wipes instead of toilet paper. Number 2. Sitz baths. A sitz bath involves sitting in warm water for about 15 to 20 minutes, which can help soothe the area, reduce pain, and promote healing. It's often recommended several times a day, particularly after bowel movements. Number 3. Manage pain. Pain relief may be necessary during the healing process. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, can help manage discomfort. Always follow your doctor's advice on pain management to avoid complications. Number 4. Dietary changes. Eating a high-fiber diet can make bowel movements softer and easier to pass, which is especially helpful for reducing strain and discomfort. If constipation or hard stools are a concern, stool softeners can be used temporarily to prevent straining and allow the surgical site to heal without additional pressure. Number 5. Wound care. You might need to pack the wound or change dressings regularly. Your healthcare provider will show you exactly how to do this. At the end, the outlook for people with anal fistulas depends on the type and complexity of the fistula and the chosen treatment method. Simple fistulas often heal well after a fistulotomy, with a low risk of recurrence. Complex fistulas, however, may require multiple procedures or advanced techniques to achieve full healing. But still, maintaining good hygiene and following a doctor's instructions for aftercare are essential for a smooth recovery. Now we want to hear from you. Have you or someone you know experienced an anal fistula? What tips or insights helped you manage the symptoms day to day? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.